and you start, wait until it jumps. Okay? But wait, we're not making it that easy. We will not see anything. Okay, point it upwards, okay? So what was the problem? We were not pointing it really upwards. But you might work if you go with the wire. You now know where the artery is. Push the wire forward and see whether you can get the wire to point into the artery. And it's not easy, and it's not easy in reality. Yeah. Okay. Yes, it's going. Are there any other vessels there this could be in? No. So this has to be correct. Okay, fine. Okay, push it further. Okay, and not further now. Because what's going to happen, the vessels are getting smaller and smaller, right? So if we continue to push this really thick wire, and you see how thick this is, into the brain, we will perforate. Okay, so we do not go higher than this. This is the maximum height. Okay, I'm picking on you, sorry. So you tell us if the wire goes higher. The wire may not go higher. Lower, okay, but not higher. So the moment you see the wire going higher, you say wire.
Wire.
Okay, you need to push the catheter higher up. Brilliant, but not the wire. Brilliant, well done. Perfect. Okay, so that's fine. Now we come to a point where we would like to see something, where we wouldn't want to know what's happening. Can we use the wire higher up? No. So what do? Change wire. Your job, change the wire. So if you take the wire out, please, and then make sort of loops out of it. So we now need a new wire. So we need a smaller wire. So let's see what we have on offer. So we go to wire, and we've got a huge variety of wires. And the important thing is we need a wire that is a 14 wire from the size. These here, the 10s, are for aneurysms, for even more tiny vessels. So 14 wire gives us some stability. So we choose a 14 wire, and from experience I can tell you the synchro is the one that works the nicest. So now this is how stiff the tip is. In this case, do we want a very stiff tip? No need, exactly. We would want a stiff tip in a stent case, for example, but in this we want flexibility for it to go up. So we take the smaller distal tip. And now comes the number one rule. When we're looking at the shape of the wire, you always let your assistant choose it, and not you. Because if it does not work, it's your fault. So you choose any shape, but remember the one thing I said, never anything straight. So you can choose anything except the 0. And I don't know which is going to work, so it's going to be, we are going to blame you if it works.
30.
30, okay, we try with a 30. I don't know, so we will see. Okay, so we've now chosen a smaller wire and a 30. Where's the wire? Physically, we need the wire. Yes, you've got it. Brilliant. And we're going to do one additional thing. We're going to use a second plane, if it works. There, a second plane, so we get an even better picture. Operator 2, please give us a better position. When we do yes, okay, let's give it another try. I'm going to, let's just have B at the moment. Okay, so probably if we have it like this would work. And now for A, for the position A, we will put it more in the middle. And if you can also, what we usually try is that we have the petrous bone, which is a bit difficult to see. It's that up there, that we have that in the middle of the orbit. So exactly cutting through the orbit. Can you see it? It's a bit, yeah, it's higher. So this one up there. That's the petrous bone. Yeah, actually that would have been the easier option, yeah. So this thing here, this needs to go directly through, and it's the petrous bone. So that's the perfect angulation. Okay, so does it look straight, operator 2? The brain, oh sorry, I need to go to floor. Yeah, now it's straight, beautiful. Okay, now what we want to do is we want to do a contrast injection. Yes. And the contrast injection, we use something which is called a roadmap. And a roadmap is something we radiologists use to cheat, because then we can see the vessel if the patient is not moving. So first of all, we need to put the roadmap in. So I asked you to press on there. And now we do an injection. And whilst you press on this one, in the middle. And when you have the maximum filling, you stop.
Yes.
Okay, eject, and now step off. Step off, okay, brilliant. The maximum injection, it then stops. So what we see here is the basilar artery, the occluded artery, and we see it's not going, it's not continuing. But we now have a pretty nice picture, and we can work on that picture. So we know how it looks like. This would be the picture in where the blockage is, and at the moment, it looks like this. Oops, so at the moment it looks like this. Okay, so we've got stable axis here. Now the next step we need to do is we need to bring the microcatheter, which is this one. And we need to use it with the wire. And that's what I sometimes do with my wire.
Yeah. Okay.
I was doing a case and the wire is so long, I had it on the floor and they were looking at me and they were saying, so that's how you work in your hospital? Okay, so the wire goes in, and again it's a very long way, we have to bring it in. And, and we have to choose the microcatheter first. So I'm choosing the microcatheter that goes with the stent device that we have here. So it's an 18 system. The stent would not work through a smaller catheter. The stroke device needs this kind of catheter. Okay, so you can start pushing it in, and at some stage we will need fluoro, because what happens sometimes is that you start pushing, and then the wire